Hi, good morning everyone. I am Rahul Nanuhal, COO at Cureka.com, and we are back with our weekly live Instagram session with a specialist doctor to take care of your specialist concerns. Last week we had discussed about how to brighten your smile, and this week we have a very special guest with us who is not only going to be talking about a concern, but that special guest is also an orthopedic surgeon and vice chairman of Devadoss Group of Hospitals. Live very soon, and we are going to discuss with him on the topic understanding arthritis. Good morning, Dr. Sathish. How are you?
Good morning, Rahul. Can you hear me well?
Yeah, I can hear you perfectly well. Yeah, thank you so much for joining us, Doctor, today.
Right.
I was just informing our guest that Dr. Sathish Devadoss is a very well-known orthopedic surgeon. He is also the vice chairman of Devadoss Hospital, and also he has got multiple other ventures where he supports and builds his vision for a healthy India. Today we are going to cover the topic of understanding arthritis. What are the common myths and facts? And let's start with our first question. Doctor, what is arthritis and how does it affect our joints?
So, to first know about what a joint is. A joint is nothing but one or two bones, or sometimes even three bones, moving together to form a motion to move part of your body. So, this is a joint. So, to have a seamless, frictionless movement, the joint is covered by what is called as a articular cartilage. The cartilage is a white, smooth, and very pristine cartilage, so that when it gets degenerated or damaged is called arthritis. So arthritis is basically a damage of the articular cartilage, that is the cartilage, the smooth layer covering the bone ends in a joint is called as the arthritis.
Right. And doctor, does it appear at a certain age or it can happen at any age?
See, arthritis can be a variety of types. One is can you see me?
Yeah, I can see you, doctor. Yeah.
So one is due to an older age group, which is called as degenerative arthritis or osteoarthritis. One is due to inflammation of the joint, which is called as inflammatory arthritis, where there are multiple arthritis called rheumatoid arthritis, ankylosing spondylitis, and other reactive arthritis. These are other forms of arthritis. But most commonly, what we see is the osteoarthritis or degenerative arthritis due to wear and tear of the joint, due to aging, and due to overwork and weight.
Right. Understood, doctor. So, doctor, are there any different types of arthritis apart from what you have shared, and how do they differ in general?
Yeah. So, like I told you, there are basically two types. One is degenerative, which is due to wear and tear, and the other one is inflammatory. Normally, the knee joint is surrounded by a membrane called as a synovial membrane, which will secrete the lubrication fluid inside the joint, which is called as synovial fluid. So this synovial fluid is very little in quantity, but that is sufficient in a joint. Like anything between 0.5 ml to 1 ml is only is required. But sometimes, due to some reasons, the synovial membrane can get inflamed, and this inflammation will cause more synovial fluid to be secreted, and this can cause swelling and severe pain of the joints. So this is a type of inflammatory arthritis. And
Mm-hmm.
apart from this, there is one more arthritis called as gout, where uric acid, which is like a salt in the body, which has to be taken out through the kidneys. This uric acid is not processed properly, and this will go and get settled in the joints, cause irritation, and cause severe pain and swelling. So this is because of a condition called gout. Here, there is this purine is a kind of amino acid which when ingested in large quantities in such individuals can cause this kind of pain called as gout.
Right, right. So, guys, who all the listeners who are listening to us, if you have got any questions around arthritis, please do mention in your comments below. We will try to take them up during this session. If not, we'll come back to you with doctor's advice on your concern after this session. So, doctor, generally there is a myth where people say arthritis pain goes away in time. So, how true is that?
It is definitely a myth. Arthritis pain does not go away in time. Coming to the two major categories, one is the degenerative, the other one is inflammatory arthritis. Degenerative arthritis can get worse in time if not tackled properly. And inflammatory arthritis usually is unpredictable nature. Most of the time, it does not go away. There are some seasonal variations also, which I'll discuss later. But arthritis does not go away if you don't take care of it properly.
Understood, doctor. So, doctor, are there any dietary factors that can contribute to arthritis?
Yes, I was talking about a few arthritis, which different arthritis, especially gouty arthritis, is the only condition where diet can cause the pain. The rest of the arthritis, like degenerative arthritis or rheumatoid or inflammatory arthritis, there is no proof that there is any causative food agent which will increase the pain in arthritis. But in gouty arthritis, those food items containing a lot of purine, like mushrooms, like beans, peas, and some red meat and alcohol, especially beer, all this can increase the pain in gouty arthritis, but in other arthritis, there is still no evidence to show that any food will improve your pain or it can increase your pain.
Understood, doctor. So, can weather or climatic effects affect arthritis symptoms in general, or is that, for example, is heat or cold applications, are they good for arthritis?
Yes. So that's a good question in the sense that the inflammatory arthritis, especially the rheumatoid arthritis, does get worse during winter time. The stiffness, pain, and swelling increases during winter time. So that is one kind of arthritis which is seasonal in nature. Of course, other degenerative arthritis also in the cold, if you don't do proper exercises, the joints can stiffen up and it can cause some pain, especially when you wake up in the morning. So this early morning stiffness is very typical of rheumatoid arthritis, but it can also occur in degenerative arthritis, especially during winter. Apart from that, applying heat or cold is a therapy which on the joint, which can help. It doesn't matter in acute pain when there is a pain is very severe. Cold is better, but when the pain is more chronic in nature, I think heat therapy, heat application is a better option compared to cold.
Understood, doctor. Right. So, are there any specific exercises or physical activities that can help to manage arthritis?
Yeah. So there are a few do's and don'ts. Most important thing is, in our Indian population, we tend to sit on the ground and squat for toilet purposes. So it is better to avoid sitting on the floor and squatting. Use a Western toilet and avoid sitting on the floor. Always look for a stool or a chair. Especially in housewives, we see they sit down for their cooking and cutting their vegetables. I always recommend them to sit on a table and chair and cut these vegetables and do their work sitting or either standing. Do not sit on the floor. Another important thing is climbing stairs. If say they are living upstairs or something on a first floor or second floor, it's better to plan your life so that you come down only once or twice a day, right? So you should not walk 5 to 10 times every day up and down the stairs. This can cause severe degenerative pain in the knee. So it's better to avoid climbing stairs, sitting on the floor, and squatting on the floor. Coming to the exercises part, yes, exercise is the mainstay of treatment of arthritis, and you need to build up the muscles around the knee joint so that the muscles will take away all the pressure going on to the knee joint. All the forces will be dissipated in the muscle. So it's best to do the exercises for the muscles around the knee joint. So quadriceps or the thigh muscle is a very important muscle which will reduce the forces down in the knee joint. So that strengthening that muscle will reduce a lot of pain and will improve the progression of the disease.
Right, right. So, doctor, you were mentioning a lot about like how squatting should be avoided, and if people are sitting down and cooking food, that should be avoided. I believe if husbands can also help their wives while cooking, can also reduce that.
Yeah, a simple help would be to just buy a bench or a table chair and make them to sit on that rather than sitting.
Around.
Yes.
So that goes a long way, doctor, in
Yes.
ensuring optimal health of the cartilage, and then you say arthritis. So typically, what are the common signs and symptoms of arthritis, doctor?
See, basically, when somebody has degenerative arthritis, which is osteoarthritis due to wear and tear and old age, there is pain is a primary symptom. There may be associated swelling. Sometimes the knee may feel a little warmer. Most often, there is pain on the inside of the knee joint. For a simple sake, we'll just stick on to the knee joint arthritis. We will not go to other joints. There are many joints in the body, but most commonly the knee joint arthritis is common. So we will just stick on to the knee. So the inside of the knee pain is most common and commonly seen in osteoarthritis. So there is pain, swelling, and stiffness of the joint in arthritis, especially osteoarthritis. These are the common symptoms. In rheumatoid arthritis or the inflammatory arthritis, what we see is multiple joint pains, which we call as polyarthralgia. That is pain in multiple joints. Usually they are symmetrical. They are seen in the finger joints. They are seen in both knee joints, hip joints, ankle joints, the feet joints. All these small joints of the body are also affected. So this here, they will be having a lot of swelling also, and it's extremely hard to touch. And they will have a lot of stiffness when they get up in the morning. So that is very typical of rheumatoid arthritis or inflammatory arthritis. So this is a very typical of rheumatoid arthritis. So the common feature is, of course, pain, swelling, and stiffness are a variable factor in these two type of arthritis.
Right, right. Thank you, doctor. Doctor, there is a question coming in from a listener, and she says that my mother-in-law is suffering from knee pain. We have planned for family trip. How to manage pain while traveling for more than 10 hours? What should we carry, doctor?
Right. So now coming to the management of knee pain. So there are primarily 3 or 4 important things. Coming specifically to the question by this listener, if she already has knee pain, then while traveling, it's better to carry some kind of a mild painkiller. I would recommend just paracetamol, nothing more than that. Twice a day, carry some ice packs, hot packs, and some topical applicants of painkillers like this gel preparations of diclofenac. So all this can help. Again, walking is not a problem, but sitting for a long time in the car, sitting for a long time in the flight or a train, it would be preferable to take a walk often, stand up and take a walk, avoid sitting for a long time, and a simple exercise for your thigh muscle, the quadriceps muscle, will help in going a long way. So, to summarize, for the question asked, mild painkillers if there is pain only, do not take it on a regular basis. Carry topical analgesics with diclofenac containing analgesic gels. Carry ice packs or hot packs which you can apply on the painful after evening, after the entire day in the evening they can apply that, and eventually exercises on a regular basis will help you on a long term basis.
Right, right, right. So they should take breaks often and then walk a bit.
Walk a bit.
Correct.
Do not be sitting for a long time.
Right, right. So, doctor, what are the natural remedies that you would recommend that can help to alleviate or reduce arthritis symptoms?
See, now to understand why degenerative arthritis occurs, then you can think of how to prevent and alleviate it. So the main causes of degenerative arthritis, which is the most common cause of arthritis, is age first. People more than 40 years of age can start developing arthritis. People who have worked very hard in their life, carrying weight, sitting and squatting for a long time. So weight is one, work is second, and then the third thing is weight. If they are extremely heavy, if their BMI is more than 26, then there is a very high chance they can get arthritis. And the last one is genetic. If your parents, your grandparents, or your uncles and aunts are suffering from arthritis, then you are prone for osteoarthritis also. So these 4 factors, work, age, weight, work, and genetical. So these 2 things you cannot control is your age and your genes. So you can control your work and your weight. So it is better to reduce your weight and it is better to reduce your work. So you can work smartly. You do not need to stop working, but you can work smartly. Like I said, avoid sitting on the floor. Walking on level surface is fine, but climbing up and down the stairs is not allowed. And walking on very slopy surfaces also to be avoided. So, so these are the causes of the knee pain, and to alleviate it is prevent it and alleviate this pain, these are some of the measures to do that. And of course, exercises, like I told you, quadriceps exercise is one of the important things. Are there any natural supplements, any food? No, till date, there is no evidence to say that there is any food material which causes arthritis or which will alleviate pain in arthritis. There is no scientific evidence so far.
Right, right. Thank you so much, doctor. That's so informative. And Subi has replied to your answer, doctor, saying that thank you so much, doctor, and so informative. So thank you, Subi, for asking the question. If you have any more questions, please do let us know. Now, doctor, can you please provide some practical tips for managing arthritis on a day-to-day basis to prevent arthritis as we age? Because you told age is an important parameter. So we cannot avoid it, but is there anything that we can do to avoid it?
Yeah. So, like I said, the weight is very important. If you reduce even 1 kg of weight, the 5 kilos of burden on the knee is reduced. So each time you climb stairs, there's so much of pressure going on to the knee joint. So even if you reduce 1 kg of weight, 5 kg of burden on the knee forces is reduced. So that will cause a lot of relief. So that is one of the most important things. So again, I want to reiterate, sitting on the floor and climbing stairs are two things to be reduced. And most importantly, build up your quadriceps muscle. So these measures should be followed on a day-to-day basis to prevent severe degenerative arthritis. Of course, it is a natural thing. Aging is natural. You will get arthritis. But why do I get and why does not my friend does not get? My friend is so fat, I am so thin. Why should I get? The reason is you may be genetically predisposed to it. Second thing is there may be a little bit of height difference in the limbs, which may not be seen very commonly. Maybe just a quarter centimeter or half a centimeter, which you don't see normally. And there may be some habit of some people to walk in a different way, in a mannerism. All this can lead to arthritis, osteoarthritis or degenerative arthritis. So these cannot be prevented such way, but you can do your exercises on a regular basis. And another important thing is nowadays we do get nutrition supplements. The cartilage is made up of amino acids and what is called as glucosamine and chondroitin. So this can be taken as supplements. It's available commercially off the shelf. And these have been scientifically proven to have some effect on long-term basis if you take them. It will not cause immediate pain relief when somebody is suffering from pain, but on a long-term basis, this will nourish the cartilage and it can prevent further degeneration. There are several preparations available. There are some herbal preparations also. Vitamin C is also excellent cartilage nourisher. So glucosamine, chondroitin sulfate, vitamin C and all are some nutritional supplements which can be taken off the shelf, and this can also help you in either preventing the arthritis, also in reducing the progress of the disease.
Right, right. Wonderful, doctor. I'm sure this is so helpful for even the youngsters who can prevent arthritis at an older age to start taking these, supplements and vitamin C and adding them into your day-to-day life. So we've got another listener who has sent a comment, Arun. Arun is saying, "Hi, sir. My mother suffered from rheumatoid arthritis. My sister also has the same condition. Will my daughter or son get the same? I'm not married to a blood relation."
It doesn't matter whether you're married to a blood relative or not, but since it is there in your family, it is a possibility. Rheumatoid arthritis is an inflammatory arthritis for which the cause is still unknown. Unfortunately, even today's scientific date and age, we do not know the exact cause of rheumatoid arthritis. So, since we don't know the cause of it, we can only control this disease. We do not have a cure for the disease. And we also see that it is more commonly seen in women, especially younger women. And also, it is, like I told earlier, it affects many joints. It is more in the winter time. It's seen swelling in the morning, stiffness is there. So, all these problems can come with rheumatoid arthritis. There is a possibility. But what we have seen in our experience is that doing yoga, swimming, exercises can reduce the incidence as well as the use of painkillers and medicines in rheumatoid arthritis. So there are some asanas in yoga where these medicines will be secreted from your own body, which are not toxic. So this is an extremely useful tip which I want to give for rheumatoid arthritis people suffering from it, where yoga can reduce the usage of medicines. There is no shortcut to it. You have to do yoga and you have to take medicines to control it. Unfortunately, till today, we don't have cure.
Wonderful. I mean, that's a great thing. I believe very few people are aware of it. Even I was not aware. So yoga can actually cure rheumatoid arthritis. That's wonderful.
Again,
So,
control is what again. It may not cure it,
yeah,
it will control
it. Okay. Okay. Understood, doctor. So, doctor, moving on, is there a cure for arthritis or is it a lifelong condition? Is there a permanent cure as of now?
Yeah. See, degenerative arthritis and rheumatoid, we'll take it separately. Degenerative arthritis is occurring in older individuals, more than 50 or 60. There, it is progressive. Usually not, it doesn't stop with that. As you age, it progresses also with it. So there is no cure for it. What happens is this arthritis, there are in the early stages, there are some newer treatments coming in where we can inject some cartilage healing agents, which is called as, which is normally used nowadays in the body everywhere else. It's called as platelet-rich plasma. So this blood is taken from the person suffering from pain, and it is only the platelets are separated from it. The platelets are injected into the joint. So in the early stages of this arthritis, this has a curative effect. So that is, we have seen in this is a newer treatment in the last 5 years, and we see that there is a better pain relief and better, lesser progression of the disease when you're using platelet-rich plasma. So that is one of the newer treatments. But if there is a later stage, then surgery is going to be your only option.
Understood, doctor. Doctor, there is a question coming in from a listener, Karthik. He says, does arthritis cause joints to fuse?
Yes. So we are talking about this inflammatory arthritis. So inflammatory arthritis, like I said, one was rheumatoid arthritis. If you had remembered, I talked something called as ankylosing spondylitis, which is ankylosing is nothing but fusion of spine joints or hip joints is commonly seen. So fusion of joints can occur in some of the inflammatory arthritis. Sometimes even in rheumatoid arthritis, the joint movements can be severely limited and crippling. But fusion can occur in ankylosing spondylitis, especially of the hip joints. So in the hip joints, the hip replacement surgery is a very successful surgery done for the last 5 or 6 decades now, and patients who have got a fused hip have an excellent life after the hip replacement surgery, especially the newer generation of hip replacement implants.
Right, right. And thank you so much for answering this, doctor. And Karthik, I'm sure you've got your answer from the doctor himself. And we have got another question coming in from Mr. Pandey, who is a cricketer. And he says that, hi, sir, I'm a cricketer, 30 years old. I practice regularly, but now, few days after practice, I have a knee pain. Please give me your suggestion on how I can clear the pain.
Right. So we are talking about arthritis, usually due to old age and rheumatoid or inflammatory. But when it comes to sports,
Yeah.
you usually don't call this as arthritis. In sports, it may be due to sports injuries. Here again,
Oh.
there may be cartilage damage, there may be ligament damage. There is another specialized cartilage inside the knee called as a meniscus. So these cartilages, ligaments, and meniscus, and sometimes the muscles surrounding the knee joint can also be damaged due to either improper warm up, improper technique, some injury during sport. All these are causes of pain during sports, especially in cricket. So, my recommendation is to get some physiotherapy done. Go to a physiotherapist, get your knee joint checked, do the proper muscle exercises which can alleviate pain. Of course, some physical therapy like heat, cold, all this can help initially. And if the pain persists, then consult your orthopedic surgeon who will examine you and pinpoint exactly whether it's a ligament tear or it's a meniscal injury or it can be any other problems. So these are the problems a sports person or cricketer can get, and it can be alleviated by physiotherapy and exercises.
Right, right. So, doctor, coming to the last question of the day, now, what are the available treatments options for the arthritis?
So treatment let us go for rheumatoid arthritis first. Like I told you earlier, it's an inflammatory arthritis which we don't know the cause for. So we need to give very low dose of anti-inflammatories. And there are some drugs available called as disease-modifying agents, which your orthopedic surgeon or rheumatologist can help prescribe for you. You need to have regular blood checkups to see how these are affecting your body, because any medicine can affect your body. So you need to keep regular checkups. Of course, nutrition supplements in the form of glucosamine, chondroitin, vitamin C, and calciums and vitamin D can help also in reducing the requirement of painkillers. Coming to osteoarthritis, first is physical therapy, weight reduction, and change of lifestyle. Don't sit on the floor. All this and exercises will help in reducing the pain and preventing the progression. If the pain is still there, then you can go for a course of physiotherapy, mild anti-inflammatories. And if your orthopedic surgeon feels that, does an X-ray and feels that there is severe arthritis, you can go in for the PRP injections, which I told you earlier stage also. And when there is severe degeneration, then there is no option but go in for a total knee replacement or a total joint replacement, where the surfaces of the cartilage which is damaged is removed, and metallic implant will be implanted inside the body, which will reduce the pain and have a very good lifestyle for the person with knee pain.
Right, right. Thank you, doctor. And One last question coming in from Mr. Selvam. He says that, like master health checkup is there. Any test to perform earlier to find out whether I'm at a risk of arthritis? I'm IT professional with low back pain and neck pain which settles with stretches.
Yes, I wouldn't recommend any kind of preemptive testing for arthritis until and unless you are suffering from any kind of pain. You need not do even an X-ray. So,
Okay.
like you said, neck pain and back pain is a very
Yeah.
common problem in IT professionals. Probably we will have a session on neck pain and back pain only,
Sure,
how
sure,
to
sure.
prevent it for IT professionals. Again,
Sure.
I would recommend yoga, your work ergonomics of your seating and all these things matter for your neck and back pain. But I wouldn't recommend any tests per se.
Okay, okay, great. So, Selvam, I hope you have got your answer, and thank you so much, doctor, for joining us today. It has been a wonderful session. I'm sure a lot of people would have learned so much about arthritis and how to prevent it, how to control it as well. Especially the part about yoga was very important to understand how we can control arthritis with the help of yoga. Right, guys? So, just to share with you, we've got multiple products to help you alleviate pain and to provide you nutritional supplements for curing or controlling your arthritis or any sort of healthcare concern on Cureka.com. We have got products from the 9 categories, more than 7,000 different products handpicked by a team of expert doctors. So do check out Cureka.com. We have got a store at Indiranagar, Bangalore, which you can visit with your family and friends. Do let us know your feedback. We've got a free of cost WhatsApp platform where you can ask questions to specialist doctors for free of cost on Cureka. So make the maximum use of it. We have got lakhs of queries coming in every single day. You can also make the best use of it to ask doctors for advice on your concern. So with this, I would like to thank doctor and wish you all a happy weekend. Thank you all, and thank you, doctor.
Thank you.
Thank you. Take care.